So here we are on HIV transmission, and it refers to transfer of HIV from one infected person to an uninfected individual. And the most common ways in which HIV is transmitted will be surely through sexual intercourse, blood transfusion, sharing of IV needles, and during pregnancy. So I would like to highlight some questions here, and maybe these questions are also the same questions that you are having or bearing in your mind about how HIV is transmitted. So, how is HIV passed from one person to another? Most people who get HIV get it through anal or vaginal sex or sharing needles, syringes, or other drug injection equipment. But there are powerful tools that can help prevent HIV transmission. Please remember that. So, one question that you can ask me is that can you get HIV from an anal sex? Can you? Anal sex. So yes, you can get HIV if you have anal sex with someone who has HIV without using protection like condoms or medicine to treat or prevent HIV. And remember, anal sex is the riskiest type of sex for getting or transmitting HIV. And we have two things here, the top and the bottom. So being the receptive partner or the bottom is riskier for getting HIV than being the insertive partner or the top. The bottom's risk of getting HIV is very high because the rectum's lining is thin and may allow HIV to enter the body during anal sex. And the top is also at risk because HIV can enter the body through the opening at the tip of the penis or urethra. The foreskin of the penis isn't circumcised, or small cuts, scratches, or open sores anywhere on the penis. And if we have anal sex, we also have vaginal sex. So can you get HIV if you have vaginal sex? Anal, we also have vaginal. So you can get HIV if you have vaginal sex with someone who has HIV without using protection, again, like condoms or medicine. So vaginal sex is less risky. Well, the thing is, it is less risky for getting HIV than receptive anal sex. Either partner can get HIV during vaginal sex, and most women who get HIV get it from vaginal sex. HIV can enter the woman's body during vaginal sex through the mucous membranes that line the vagina and the cervix. And also men can also get HIV during vaginal sex. This is because of vaginal fluid and blood can carry HIV, and men can get HIV through the opening at the tip of the penis or urethra. The foreskin of the penis isn't circumcised, or small cuts and scratches or open sores anywhere on the penis. And can HIV be transmitted from a mother to her baby? So that question. So HIV can be transmitted from a mother to her baby during birth, breastfeeding, and pregnancy. However, it is less common because of the advances in HIV protection and treatment. So this type of transmission is called perinatal transmission or mother to child transmission. Mother to child transmission is the most common way that children get HIV. So most risky is anal sex, while the most common way that children get HIV is mother-to-child transmission. And recommendations to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies who are born with HIV. And another question in my, can you get HIV from sharing needles, syringes, or other drug injection equipment? You are at high risk for getting HIV if you share needles, syringes, and other drug injection equipment. Needles, syringes, and other drug injection equipment with someone who has HIV. Never share needles or other equipment to inject drugs, hormones, steroids, or silicone. Because used needles, syringes, and other injection equipment may have someone else's blood on them, and the blood can carry HIV. And people who inject drugs are also at risk of getting HIV and other sexually transmitted infections because they may engage in risky sexual behaviors like having sex without protection. Okay, and also doing this, you're also at risk for getting Hep B and Hep C and other infections if you share again needles, syringes, and other injection equipment. So, however, guys, there are some rare ways that HIV has been transmitted. So, There is little to no risk of getting HIV from the activities that I will be mentioning later. However, for transmission to occur, something very unusual would have to happen, like oral sex. So, oral sex involves putting the mouth on the penis or vagina or anus. And factors that may affect this risk include ejaculation in the mouth with oral ulcers, presence of bleeding gums or genital sores, and the presence of other STIs. You can get other STIs from oral sex, okay? So we have anal, vaginal, and oral, but oral is a rare form of getting it. And if you get feces in your mouth during uh, anilingus, you can get Hep A and Hep B and parasites like Giardia and bacteria like Shigella, Salmonella, Campylobacter, and E. coli. So oral sex is not so nice at all. And you can, in the workplace, the most likely cause is being stuck with a contaminated needle or another sharp object. That's what we call percutaneous inoculation, and careful practice of standard precaution protects patients and healthcare personnel from possible occupational HIV transmission. Medical care also. So in the US, the US blood supply and donated organs and tissues are thoroughly tested, so it is very unlikely that you would get HIV from blood transfusions, blood products, or organ tissue transplants. You cannot get HIV from donating blood, and blood collection procedures are highly regulated and safe. Also, you can have HIV, children can have HIV from pre-chewed food. So the only known cases are among infants. Contamination happens when blood from a caregiver's mouth mixes with the food that is pre-chewed before feeding to an infant. You can get HIV from consuming food handled by someone with HIV, okay? Biting. So each of the very small number of documented cases has involved severe trauma with extensive tissue damage and the presence of blood. Transmission can occur when there is contact between broken skin, wounds, or mucous membranes, and blood or body fluids mixed with the blood of a person who has HIV. There is no risk of transmission if the skin is not broken. Again, in biting, there is no risk of transmission if the skin is not broken. Next, you can also have HIV through deep open mouth kissing. Although very rare, transmission can happen if both partners have sores or bleeding gums and blood from the partner with HIV gets into the bloodstream of the HIV negative partner. HIV is not transmitted through close mouth or social kissing with someone who has HIV. HIV is not transmitted through the saliva. You need to get a liter of saliva to get infected. We also have female to female. So female to female transmission of HIV are rare. Vaginal fluids and menstrual blood may carry the virus and expose these fluids through mucous membranes in the vagina or mouth and could potentially lead to HIV infection. Also, tattoos and body piercings. However, it is possible to get HIV from tattooing or body piercing if the equipment used for these procedures has someone else's blood in it, or if the ink is shared. This is more likely to happen when the person doing the procedure is unlicensed because of the potential for unsanitary practices such as sharing needles or ink. And if you get a tattoo or a body piercing, be sure that the person performing the procedure is properly licensed and that they use only new or sterilized needles, ink, and other supplies. Okay? So much for the transmission. So we will be defining here high-risk behavior. So what are those? It refers to a person's frequent involvement in certain activities or behaviors which really increase the risk of transmitting or acquiring HIV. So alcohol and drug use. When you're drunk or high, you're more likely to engage in risky sexual behaviors like having sex without protection, like not having condoms or medicines to treat or prevent HIV. Well, guys, remember, being drunk or high affects your ability to make safe decisions, right? Remember, in vino veritas, in wine there is truth. So whenever you're drunk, your inhibitions, you're no longer having inhibitions, and drinking alcohol, particularly binge drinking and using club drugs, can alter your judgment, lower your inhibitions again, and impair your decisions about sex or drug use. You may be more likely to have unplanned sex, have a harder time using a condom the right way every time you have sex, or have more sexual partners or use other drugs. If you're going to a party or another place where you know you'll be drinking or using drugs, you can bring a condom so you can reduce your risk of getting or transmitting HIV if you have vaginal or anal sex. So in the US, the most common ways are having vaginal or anal sex, so high risk behaviors with someone who has HIV without using a condom or taking medicines to prevent or treat HIV. Again, I'm always telling you this, that anal sex is riskier than vaginal sex. In fact, it is the highest risk behavior of all in which you can contract HIV, anal sex, okay? Informed consent. It refers to the voluntary agreement of a person to undergo or be subjected to a procedure based on full information. Whether such permission is written, it could be written, it could be verbally reported by the patient or expressed directly. So informed consent is a process of communication between you and your healthcare provider that often leads to agreement or permission of care, treatment, or services. Every patient has the right to get information and ask questions before procedures and treatments. Again, remember, guys, every patient, you, for example, is a patient. You have the right to have the information and ask questions before procedures and treatments, like full revelation of the procedure. You need to know that, because informed consent is a principle in medical ethics and medical law that a patient should have sufficient information before making their own free decisions about their medical care. And there are four components of informed consent, including we have decision capacity, documentation of consent, disclosure, and competency. We also have medical confidentiality. This one, majority of the people, there are breaches here in medical confidentiality. It refers to the relationship of trust and confidence created or existing between a patient or a person with HIV and his attending physician, the consulting medical specialist, the nurse, the medical technologist, and all other health workers or personnel involved in any testing, counseling, professional care of the former. It also applies to any person who in any official capacity has acquired or may have acquired such confidential information. Guys, again, the patient has the right to demand that all information, communication, and records pertaining to his care be treated as confidential. In case the patient is not of legal age or is mentally incapacitated, such information shall be given to the parents, legal guardian, or his next of kin. Confidentiality applies not only to the test results and reports of HIV status, but also to any personal information, such as information concerning sexual behavior and the use of illegal drugs. Okay, so that's for medical confidentiality. And pre-test counseling, it is the process of giving an individual information and the biomedical aspects of HIV/AIDS. It's like a lecture on what HIV/AIDS is all about, and not only on the theoretical aspect, but also on on the emotional support to any psychological implications of undergoing HIV testing and test results itself before he or she is subjected to the test. Next is post-test counseling. It refers to the process of providing risk reduction information and emotional support of person who submitted to HIV testing at the time the result is released. So there's a pre-test, there's also a post-test counseling, because some patients may not be able to handle the truth that they are HIV positive and might have depression, anxiety, or might resort to suicide. So there's really this post-test counseling, and not all those. They might, because of depression or anxiety, they might involve in high-risk behaviors like trying to transmit the virus to others, like with the malice or intent to really transmit it. So pre-test and post-test counseling are are definitely needed. Next, we have a prophylactic. Well, what is a prophylactic? It is a medicine. It could be a medicine. It could be a condom, or for example, a condom or a course of action used to prevent disease. So in medicine, the term prophylactic is used to describe procedures and treatment that prevent something from happening. So we are trying to prevent the presence of infection to happen. And this can include surgeries, dental cleaning, vaccines, and birth control. But for example, a prophylactic hepatitis vaccine prevents the patient from getting hepatitis. So that's it. In case of HIV, we have PrEP. So you might wonder what's PrEP. So that's your PrEP is a pre-exposure prophylaxis. It is a course of HIV drugs taken by HIV negative people to protect them against HIV infection. Truvada has been approved for use as PrEP in many countries. This is the PrEP. And it is a single pill that is a combination of two anti-HIV drugs, tenofovir and emtricitabine. And we also have PEP. If we have PrEP, we also have PEP, or post-exposure prophylaxis. It is a short course of HIV medicines taken very soon after a possible exposure to HIV to prevent the virus from taking hold in your body. So you must start PEP or PEP within 72 hours or 3 days after a possible exposure to HIV, or it won't work. So every hour counts. Again, we have PrEP and we also have PEP. Yeah. PrEP is your pre-exposure prophylaxis. We also have PEP, which is your post-exposure prophylaxis, pre and post. We also have sexually transmitted disease, or STDs. Now we know them as STIs. It refers to any disease that may be acquired or passed through sexual contact. So STIs are infections, again, that are passed from one person to another through sexual contact. The contact is usually vaginal, oral, or anal sex. But sometimes they can be spread through other intimate physical contact. So examples will be what we have: HPV, human papillomavirus, we have chlamydia, syphilis, HIV, gonorrhea, pubic lice, the crabs, trichomoniasis, and herpes. Next, we have voluntary HIV testing. So what is voluntary? Something voluntary is done, given, or acting of one's own free will. Again, if we are talking about voluntary, it is given, it is done, or being acted of one's own free will. There's no compulsion, no coercion, there's no force given. So it refers to HIV testing done on an individual after having undergone a pre-test counseling. So after undergoing a pre-test and willingly, if you're willing, it's done voluntarily, submits himself to such a test. We also have the window period. This window period, this phrase is very important. You need to know this. It's a common board exam question. It refers to the period of time usually lasting from 2 weeks to 6 months, quite long, and during which an infected individual will test negative upon HIV testing. Yes, negative, but can actually transmit the infection. This is the good thing, but this is the bad thing. Next, during the window period, a person can have HIV, yes, because you have HIV and can be very infectious, but still test negative with the disease or the virus. The window period refers to the time after infection and before seroconversion. This is the medical definition. During which markers of infection, what are the markers of infection? We're looking at P24 antigen and antibodies are still absent or too scarce to be detectable. And tests cannot always detect HIV infection during the window period, sadly. So we have Article 1. Moving on, on Article 1 is on education and information. So HIV/AIDS education in school. So utilizing using information provided by DOH, DepEd, CHED, and TESDA shall integrate instruction on the causes, modes of transmission, and ways of preventing HIV/AIDS and other STDs or STIs in subjects taught in not only public but also in private schools at intermediate grades, high schools, and tertiary levels, including non-formal and indigenous learning systems, provided that if integration of HIV/AIDS education is not appropriate, so it is the responsibility of TESDA and DepEd or CHED to design special modules on HIV/AIDS prevention and control, provided that it shall not be used as an excuse to propagate birth control or the sale or distribution of birth control devices. And provided finally that it does not utilize sexually explicit materials. So what are sexually explicit materials? It refers to textual, visual, or audio materials that typically intends to arouse the viewer and depicts sexual activities and arouses genitals in unconcealed ways, usually with close-ups on oral, anal, and vaginal penetration. So those are sexually explicit materials and should not be used in during the presentation of education and information on HIV/AIDS and AIDS, okay, in schools. And Section 4 under this RA also mandates that all teachers and instructors, of HIV/AIDS courses should be are required to undergo a seminar or training on HIV/AIDS prevention and control, as supervised by DepEd, CHED, and TESDA, and in coordination with DOH before teachers or instructors or professors are allowed to teach the subject to the students. And we also have HIV/AIDS information as a health service. So this one, HIV/AIDS education information dissemination shall form part of the delivery of health services by health practitioners, workers, and personnel. So it is considered a civic duty of health providers in the private sector to make available to the public such information needed to control the spread of HIV and to correct common misconceptions about AIDS or HIV/AIDS. So the training of health workers should include discussions on HIV-related ethical issues such as confidentiality, informed consent, and the duty to provide treatment. So these are the things that are at most importance under Section 5. And then Section 6, HIV/AIDS education in the workplace. So the law directs that all government, private employees, workers, managers, supervisors, including members of the Armed Forces of the Philippines and the Philippine National Police, shall be provided with a standardized basic information and instruction on HIV/AIDS. We shall include topics on, again, we're always talking about this confidentiality in the workplace and attitude towards infected employees and workers. It has to be kept confidential. But the problem with us, there are too many maritases in our workplace and even in our classmates, guys, right? And then HIV/AIDS education for Filipinos going abroad. So the country shall ensure that all Filipino workers bound overseas and diplomatic, military, trade, and labor officials and personnel to be assigned overseas should undergo or attend a seminar on the cause and prevention and consequences of HIV/AIDS before they are certified or bound for overseas assignment. And then we also have information on prophylaxis. You know what prophylaxis are. We have the medication, and condoms also can be used as a prophylactic for against HIV/AIDS. So we are talking about information about prophylaxis. So appropriate information shall be attached to or provided with every prophylactic offered for sale or given as a donation. And it must come in English and Filipino and contain literature and the proper use of the prophylactic device or agent. We have the agent with the device, could be the condoms, or the agent, we have the therapeutic agents, the drugs, and its efficacy to against HIV and STD infection, as well as the importance of sexual abstinence and mutual fidelity. Well, sexual abstinence is the best to prevent transmission, but I know majority of people can do this. Well, section 11, moving on, we have penalties for misleading information. So misinformation on HIV/AIDS prevention and control through false and misleading advertising and claims in any of the tri-media or the promotional marketing drugs or devices, agents, or procedures without the approval from DOH or BFAD, guys. Without the approval from DOH and BFAD it is punishable with a penalty of imprisonment for 2 months to 2 years. Again, penalties for misleading information, 2 months to 2 years. And then Article 2, we are now on the safe practices and procedures. So Section 12, it instructs the requirement on the donation of blood and tissue or organs. So no lab or institution shall accept a donation of tissue or organ, whether such a donation is gratuitous or onerous. So onerous, it involves heavy obligations, while gratuitous donations are given or done free of charge, unless a sample from the donor has been tested negative. So labs will only accept blood, tissue, or organs if those are negative for HIV, and all donated blood shall also be subjected to HIV testing, and HIV positive blood shall be disposed of properly and immediately. If it's positive, disposed properly and immediately. Well, blood testing, a second testing can be demanded if usually a blood testing of the blood for donation usually is just done once, but it is the law gives the patient the right to demand a secondary testing. Okay, so remember this one. And HIV positive blood, tissue, or organ, always remember, can be utilized for research purposes only. Research purposes only. And the guidelines on surgical and similar procedures. So it will be the DOH which shall issue guidelines on precautions against HIV transmission during embalming, dental, surgical, tattooing, or similar procedures. Remember, guys, the cadavers of HIV positive individuals will not undergo embalming processes. Okay, there is no embalming processes. And also likewise issue guidelines on handling and disposition of cadavers, body fluids, or waste of persons known to be believed to be HIV positive. So there's a yellow tag attached to the cadaver or to the samples, yellow tag, and yellow garbage bags. Also remember, yellow for something infectious. And PPEs shall be made available to all physicians and health workers. Next, penalties for unsafe practices and procedures. So any person who is acting with a motive, who knowingly, or it could be negligently causes another person to get infected with HIV in the course of his profession, whether he's a medtech, a nurse, a doctor, through unsafe or unsanitary practice or procedure, is liable to suffer a penalty of 6 years to 12 years imprisonment. So for example, you negligently caused or stuck your coworker with a syringe, and that syringe contains HIV positive blood, and your coworker really tested positive afterwards, then you are deemed for an imprisonment of 6 years to 12 years. It could be the law mandates or clearly signifies that any person, either knowingly you are acting with motive or malice, or it's just there's no motive, there's no malice, but you're just tanga, you are negligent. So you can be imprisoned from 6 years to 12 years. Actually, this happened in one of our labs, but I don't know how that one was handled. Okay. And also the permit or license of any business entity and the accreditation of hospitals, laboratory, and clinics may be canceled or withdrawn. Again, cancelled or withdrawn if the said establishments fail to maintain such a safe practice and procedures. Well, for mentioning that incident, since there was no further like lawsuit filed, so it could be that the one who got stuck tested negative. So there's no case and there was no case filed. Okay, to avoid problems. Okay. Next, we also have Article 3, testing, screening, and counseling. So what is consent? Consent is the permission for something to happen or agreement to do something. So consent as a requirement for HIV testing. So HIV testing cannot be mandated. Like for example, like I wanted to test you on the presence of HIV antibodies or HIV antigens. You cannot say that to your worker or subordinates in the lab, for example. No compulsory HIV testing shall be allowed. The law signifies that no compulsory HIV testing shall be allowed. However, the state shall encourage voluntary testing for individuals with a high risk of contracting HIV, provided that written informed consent must be first obtained. So there's a written informed consent, and then this is done voluntarily, so we can have the testing. But if there, in the absence of the written informed consent and voluntary testing, then we cannot proceed with the testing itself. And such consent shall be obtained from the person concerned if he is of legal age, or from parents or legal guardian in case of minor or mentally incapacitated individuals, those who are insane. Next, lawful consent to HIV testing of a donated human body organ or tissue or blood shall be considered having been given when it means that you lawfully consented to HIV testing when a person volunteers or freely agrees to donate his or her blood, organ, tissue, or for transfusion, transplantation, or research. Or a person has executed a legacy in accordance with Section 3 of RA 7170 or the Organ Donation Act of 1991, and C, if a donation is executed in accordance with Section 4 of RA 7170. We also have prohibitions on compulsory HIV testing. So compulsory HIV testing as a precondition to employment, admission to educational institutions, the exercise of freedom of abode, ensure continued stay in the country or the right to travel, the provision of medical service or any other kind of service, the continued enjoyment of said undertaking shall be deemed unlawful. Again, there is no such a thing as compulsory HIV testing, especially in the following mentioned instances. Like for example, your university will require you to undergo compulsory HIV testing. That's wrong. Like for example, your workplace mandates compulsory HIV testing. It's unlawful. Okay, under Section 16. However, there are exceptions to the prohibition on compulsory testing. Okay, because compulsory HIV testing may be allowed in only in the following instances. We have 3 instances. When the person is charged with any of the crimes punishable under the revised Penal Code of the Philippines, when the determination of the HIV status is necessary to resolve relevant issues under EO number 209, known as the Family Code of the Philippines, and when complying with the provisions of RA 7170, otherwise known as Organ Donation Act, and RA 7719, known as the National Blood Services Act. Okay, so these are the exceptions to the prohibition on compulsory testing, meaning the person really has to undergo mandatory compulsory HIV testing in these scenarios. Okay, if you will donate blood, if you will donate organ, if you are like paternity testing, and if you are charged with any of the crimes under the revised penal code. And then anonymous HIV testing. So the state should provide a mechanism for anonymous HIV testing and should guarantee anonymity and medical confidentiality in the conduct of such tests. Anonymous testing, because anonymous testing contributes to early HIV testing and medical care. And we also have the pre-test and the post-test counseling. So all testing centers, clinics, or laboratories which perform any HIV test shall be required to provide and conduct free pre-test counseling and post-test counseling to persons who avail of their HIV/AIDS testing services. So if you will get tested in clinics or labs, so it's their responsibility to provide free pre-test and post-test counseling. We have Article 4, Health and Support Services. So hospital-based services, so persons with HIV/AIDS shall be given basic health services in all government hospitals without prejudice to optimum medical care, because there's a tendency here that we will discriminate persons with HIV, right? So easy to say this, but in the real setting, it's really happening that there's discrimination. And we also have Article 5, monitoring. So what program is responsible for monitoring AIDS in our country? We have AIDS Watch. So this is to determine and monitor the magnitude and progression of HIV infection in the country, and for the purpose of evaluating the efficacy and efficacy of the countermeasures being employed. So reporting procedures. All hospitals, clinics, labs, and testing centers for HIV/AIDS shall adopt measures in assuring the reporting shall be reported to the national level and should give confidentiality of any medical record, personal data, file, including all data which may be accessed from various databanks of or information systems. And contact tracing. So any gathered information shall remain confidential and classified, okay? Remain confidential and classified and can only be utilized for statistics and monitoring purposes, and not as basis or qualification for any employment, school attendance, freedom of abode or travel. Again, not as a basis for the qualification for any employment. For example, you tested HIV positive and the employer will tell you during interview that you're not allowed. That's unlawful. Or like, for example, you tested positive and your university will tell you to stop studying in their university because you tested positive. That's very unlawful. And for example, if your community, the village you're living in, knew that you're HIV positive, accidentally knew that you're HIV positive, and they will tell you to be evicted from the village, that's unlawful. Okay, we also have medical confidentiality. So all health professionals, medical instructors, workers, employers, recruitment agencies, insurance companies, data encoders, and other custodians of any medical record, file data, or test results are directed to strictly observe confidentiality in the handling of all medical information, particularly the identity and status of persons with HIV. And then we also have, the exceptions to the mandate of confidentiality. So medical confidentiality shall not be considered breach in the following cases. So there is no breach in the following cases in medical confidentiality if we are complying with the reportorial requirements in conjunction with the AIDS Watch programs. If we are informing other health workers directly involved or about to be involved in the treatment of a care of a person, provided that such treatment or care carry the risk of HIV transmission. Provided further that such workers shall be obliged to maintain the shared medical confidentiality. So still maintain the shared medical confidentiality. And when reporting to a subpoena duces tecum and subpoena ad testificandum issued by a court with jurisdiction over legal proceeding, where the main issue is the HIV status of an individual, provided that a confidential medical record shall be properly sealed by its lawful custodian after being double-checked for accuracy by the head of the office or department. Provided further that the judicial proceeding be held in executive sessions. So we have 3 cases in which medical confidentiality shall not be considered breached. Okay. And then the release of HIV/AIDS test. Can we just release the test results to anyone? No. All results of HIV/AIDS testing shall be confidential and shall be released only to the following persons. So the person who submitted himself to such a test, the patient himself, either parent of a minor child who has been tested, a legal guardian in case of mentally incapacitated individuals or orphans, a person authorized to receive such results in conjunction with the AIDS Watch program, so AIDS Watch personnel, and a justice of the Court of Appeals or the Supreme Court as provided under subsection C of this Act and in accordance with the provision of section 16. Okay, the person, the parent, a legal guardian, those person, AIDS Watch personnel, and the justices of the Court of Appeals or the Supreme Court can have the test results. Penalties for violation of confidentiality. So those persons will suffer the penalty of imprisonment for 6 months to 4 years. Not long, right? Like you are a marites, so you can be imprisoned from 6 months to 4 years. Like you revealed the truth about your coworkers. That's you've just tested your coworker's blood and then it tested positive and then you revealed it to the lab, the entire lab. You will be imprisoned for 6 months to 4 years. But there is no case if there is no case filing from the side of the one whose confidential medical record was breached. Next, section 34. This applies to couples or married couples or those living in and all those couples. Any person with HIV is obliged. So you are obliged. It's your obligation to reveal your HIV status and health condition to your spouse or sexual partner at the earliest opportune time. Well, you can be penalized if you will not disclose your HIV status to your spouse or sexual partner. And not doing so can become a ground for marriage annulment if you are married. And speaking about HIV, this openly combats stigma, and stigma usually arises from a lack of understanding, misinformation, and not ever having met someone with HIV. As someone who is living with HIV, you can help to change this. So disclosure becomes easier the more you do it. So it's really your obligation to reveal, to tell the truth to your partner about your HIV status, okay? So easy to say, but I know some people keep the truth hidden because they are afraid that their partners will leave them or the relationship will be broken because of this. But if that someone really can understand the situation, so it will be easier on the part of the patient. But if not, then this causes a problem. But this Republic 8504 really commands that there must be full disclosure of the HIV status of an individual to his sexual partner or spouse, okay? And then Article 7, we have discriminatory acts and policies. So discrimination in the workplace and termination from work shall be deemed unlawful. So discrimination in any form, from pre-employment to post, take note, pre-employment or post-employment, including hiring, promotion, or assignment. Like for example, you tested positive and your supervisor or head told you that you cannot be promoted because you're HIV positive. That's unlawful. Like for example, you are the best in your team, but you tested positive for HIV, and then they said you can't be the leader of the team because you are HIV positive. That is prohibited by law. And if, for example, you will be terminated from work just because of the sole basis of actual or perceived or suspected HIV status still is prohibited, it's unlawful. Okay, so at least now you guys know what are your rights. God forbid you'll test positive for HIV in the future. So these are the things. And also discrimination in schools. No educational institution shall refuse admission or expel, discipline, segregate, or deny participation or benefits or services to a student or a prospective student on the basis of his or her, it could be actual, perceived, or suspected HIV status. Restriction on travel and habitation. So here, the freedom of lodging, travel, or the freedom of abode of a person with HIV shall not be abridged. So no person shall be quarantined, no person shall be isolated or refused lawful entry or deported from the Philippine territory on account of his or her actual or perceived or suspected HIV status. So we should prevent discrimination. And well, persons who tested positive for HIV still can have the right to seek an elective or appointive public office. They can still run in elections because they shall not be denied to these right to seek elective or appointive public office shall not be denied to a person with HIV. Okay, and exclusion from credit and insurance services. So all credit and loan services, including health, accident, and life insurances, shall not be denied to a person just on the basis of his actual perceived or suspected HIV status, provided that a person has not concealed or misrepresented the facts. So the person or the patient with HIV must not conceal and must not hide the truth from the insurance company. Okay, and discrimination in hospitals and health institutions. So no person according to the law shall be denied healthcare service or be charged with a higher fee on account of his HIV status, whether it is actual, perceived, or suspected. Okay, and then denial of burial services. A deceased person who had AIDS or who was known, suspected, or perceived to be positive with HIV shall not be denied any kind of decent burial services. So they can be buried decently. And then we also have penalties for discriminatory acts and policies. So all discriminatory acts and policies referred to this RA 8504 shall be punishable, with a penalty of imprisonment for 6 months to 4 years and a fine not exceeding 10,000. 6 months to 4 years and then 10,000. And in addition, licenses, permits of schools, hospitals, and other institutions found guilty for committing discriminatory acts and policies shall be revoked. And remember, a revoked license is invalid forever. We also have a PNAC, or the Philippine National AIDS Council, as created by virtue of Executive Order Number 39, dated December 3, 1992. This is reconstituted and strengthened to enable the Council to oversee an integrated and comprehensive approach to HIV/AIDS prevention and control in the Philippines. And this Council is attached to DOH. Well, the functions for PNAC, PNAC or PNAC shall be the central advisory, planning, and policy-making body for the comprehensive and integrated HIV/AIDS prevention and control program in the Philippines. But for the functions, please refer to the Article 8 of this RA for the specific functions of PNAC. So this is the end of RA 8504, and I'm hoping, for example, if you are actually active, just remember this RA. Good day and enjoy, guys.